Today's presentation will discuss the TRICARE benefits available to the beneficiaries who are eligible for both TRICARE and Medicare. This slide shows the three TRICARE regions in the United States. As you may know, we're in the North region. The regional contractors listed here are responsible for customer service in each TRICARE region. Your regional contractor is Health Net Federal Services. TRICARE beneficiaries who are entitled to Medicare Part A, hospitalization, based on attaining age 65, disability, or end-stage renal disease, ESRD, must have Medicare Part B coverage for outpatient care to remain eligible for TRICARE. There is an exception. Active duty service members, active duty family members, beneficiaries who have purchased TRICARE Reserve Select or TRICARE Retired Reserve, and those enrolled in the U.S. Family Health Plan. Individuals not eligible for premium-free Medicare Part A are not required to have Medicare Part B. If you signed up for Medicare and are not eligible for premium-free Part A under you or your spouse's, including divorced or deceased spouses, Social Security numbers, you receive a Notice of Award or Notice of Disapproved Claim from the Social Security Administration. To keep your TRICARE coverage, take the Notice of Award or Notice of Disapproved Claim to a Uniform Services Identification card issuing facility to have your DEERS record updated and receive a new ID card. This allows you to keep your eligibility for TRICARE Prime or TRICARE Standard and TRICARE Extra after you turn 65. To ensure that your TRICARE coverage continues without a break, contact Wisconsin Physician Service, WPS/TFL, after you update your DEERS record. If you are not eligible for premium-free Medicare Part A under your own Social Security number when you turn 65, you must file for benefits under your spouse's, including divorced or deceased spouse's Social Security number, if he or she is 62 or older. If your spouse or divorced spouse is not yet 62, you must file for benefits under his or her Social Security number when he or she turns 62. If you will be eligible under your spouse's Social Security number in the future, you should sign up for Medicare Part B during your initial premium enrollment period to avoid paying monthly Part B surcharges for late enrollment. Even if you are not eligible for premium-free Medicare Part A, you are eligible for Part B at age 65. See Medicare entitlement based on age in this section for more information. 90 days before your 65th birthday, you will receive a letter from DEERS indicating that your TRICARE benefits are about to change. If you do not receive this letter, call 1-800-538-9552. You will have an initial enrollment period to get Medicare Part B coverage, which spans from 3 months before your birthday month to 3 months after your birthday month. We recommend that you sign up in the 3-month period before your birthday so that your coverage begins during your birth month. If you sign up after your birth month, you will have a break in your TRICARE coverage. If you miss the initial enrollment period, your next opportunity is the general enrollment period, January 1st through March 31st. Your coverage will begin in July, and you may be responsible for a Medicare Part B premium surcharge. There may be a lapse in your TRICARE coverage until your Medicare Part B is effective. The SSA provides an annual Social Security statement, which provides an estimate of your Social Security benefits. Read this very carefully. If you have earned enough credits to qualify for Medicare at age 65, there will be a statement that tells you to contact Social Security 3 months before your 65th birthday to enroll in Medicare. After you sign up for Medicare, you will receive a Medicare card indicating coverage for Part A and Part B. You will be given the option to decline Part B coverage. Remember, in most cases, you must have Medicare Part B to remain eligible for TRICARE, so look at all your options before declining Part B coverage. If you decline Medicare Part B, you may not be eligible for TRICARE. If you are under age 65 and are disabled or have ESRD and have been entitled to Social Security Disability or Railroad Retirement Board benefits for a period of 24 months, you will be enrolled automatically in Medicare Parts A and B beginning with the 25th month of entitlement. If you are an active duty family member and your active duty sponsor is about to retire, you'll need to enroll in Medicare Part B to remain eligible for TRICARE. Please note, you should enroll before your sponsor retires so coverage is not lost. You can enroll in Medicare Part B anytime before your sponsor retires, or you can enroll in Medicare Part B during an 8th-month special enrollment period following his or her retirement date. The special enrollment period also applies to Medicare-eligible active duty family members covered through an employer group health plan based on current employment. The special enrollment period does not avoid loss of coverage. Beneficiaries entitled to Medicare Part A but who do not have Medicare Part B may lose coverage upon retirement of their sponsor. You can take your letter from Social Security, which includes your Medicare Part A and Part B effective dates, to a Uniform Services ID card facility to have your Medicare status updated in DEERS. You do not have to wait to get your Medicare card to update DEERS with your Medicare eligibility. You may be issued a new Uniform Services ID card when you update DEERS with your Medicare information. At age 75, eligible family members will receive a permanent Uniform Services ID card, meaning it will no longer expire. Until their permanent ID card is received, family members will need to continue to have their ID card updated by the expiration date. For more information, please visit www.tricare.mil/DEERS. We'll discuss each of the programs in more detail. Please note that TRICARE Prime is available only to beneficiaries under age 65 or to those beneficiaries age 65 and over who do not qualify for premium-free Medicare Part A. With TRICARE Prime, you'll receive most care from an assigned primary care manager, and he or she will provide referrals for specialty care. TRICARE Prime enrollment fees are waived for Medicare-eligible retired family members. If one family member with Medicare, $230 is waived. If more than one family member with Medicare, $460, the whole amount is waived, regardless of total number of Medicare-eligible family members. With TRICARE Prime, there are no claims to file in most cases. However, if claims are paid, they are processed by Wisconsin Physician Service, TFL branch. If interested, you'll need to enroll with your regional contractor. All Medicare-eligible TRICARE beneficiaries are eligible to use TRICARE for Life, a program where TRICARE serves as Medicare wraparound coverage. With TRICARE for Life, you can receive care from any Medicare provider, and usually Medicare providers are also TRICARE authorized. Care also is available at military treatment facilities on a space-available basis. There are no enrollment fees for TRICARE for Life. In most cases, when you get care, your provider will file the claim with Medicare. After Medicare pays its portion, Medicare forwards the claim automatically to TRICARE, and TRICARE pays the provider directly. Wisconsin Physician Service, WPS, is the contractor for TRICARE for Life, claims processing, and customer service. So if you are using TRICARE for Life, you'll contact WPS if you need assistance, not your regional contractor. There is not a TRICARE for Life card. All you need to get care is a Medicare card along with your Uniform Services ID card. Here's an example of what your Medicare card will look like. If you don't have this or need another one, contact Medicare for assistance. When using TRICARE for Life in the United States, Guam, Puerto Rico, or the U.S. Virgin Islands, you shouldn't have to file a paper claim. In most cases, the claims process is completely seamless to you. This is usually how it works. You visit any Medicare certified provider and get care. You pay nothing at the time of service. Your provider files the claim with Medicare. Medicare pays its portion and then electronically forwards the claim to TRICARE, unless you have OHI. We'll discuss this on slide 15. TRICARE pays the remaining amount directly to your provider. You receive an explanation of benefits, or EOB, from Medicare and TRICARE. Here's a snapshot of your out-of-pocket costs when using TRICARE for Life. For a more detailed breakdown of costs associated with TRICARE for Life, visit www.tricare.mil/costs. In the U.S. territories like Guam, Puerto Rico, and the U.S. Virgin Islands,